Hi, my name is Magnus Bush, and I'm here to talk to you about concussions. Lots of kids do stupid stuff, and I was no exception. I consider myself very lucky to have never had a broken bone or anything like that, but I have had 4 concussions, 3 of which before I was 12, and my most recent and 4th when I was 14. Most of these came from stupid stunts like jumping the sled into a tree or jumping off a bounce house when I was 8 years old. But what I didn't realize at the time is that since I was getting a new concussion every 1.5 years, my brain had less and less time to recover, and it was becoming easier and easier for me to get a new one because of the compounding effect. I got to the point where I was in PE when I was 14 and we were playing tennis, and I got hit in the head with a tennis racket. And for what a normal person with no concussion history would have just been a lump on the head, ended up putting me out of school for 2 months. This compounding effect is something that we have to be aware of, especially when people are young. You hear about this sort of thing in football mostly because of the nature of the sport and how players are hit repeatedly, just over and over and over again. But this sort of thing occurs in other sports too. So you can imagine that my parents weren't too happy with the idea of me taking up mountain and road bike racing when I was 15. They urged me to consider the risks because of how many head injuries I had had, but they eventually gave in, and I ended up racing for almost 6 years concussion-free. So my point isn't to say avoid dangerous activities or don't do what you want to do. You just have to take precautions and acknowledge the risks. One of the biggest risks that comes along with repetitive head injuries is CTE, or development of CTE. And CTE stands for chronic traumatic encephalopathy. This most often occurs in boxers, football players, or veterans that have experienced combat. And CTE is a degenerative brain disease which causes proteins to grow in your brain, which slowly displace and kill brain cells. CTE has many symptoms. They're very hard to detect without scans, but there are a few that you can look for, including behavior or impulse control issues, depression, aggression, and paranoia. And while CTE is the most severe long-term effect of head trauma, there are many smaller issues that I'm going to address that come with repetitive head injury. Most people who have had a concussion, and most football players, know that you have to take a baseline test for concussions so that when you become concussed, or if you get a concussion again, you have a baseline to compare your cognitive recovery to. The issue with this is that a lot of people, including myself, had never taken a baseline test until after their first or second concussion. And according to Science Daily, these baseline tests can actually increase the likelihood of more damage because of the high false negative rates on the tests, which essentially means that you can pass the test without being fully recovered. This becomes a problem when an injured athlete is given recovery period by a doctor, but they are able to match their baseline score before the period is up, which means that they're able to go back and play and become more likely to be injured again without having ever fully recovered just because they were able to pass their baseline test. Another study done on football players showed that those with 3 or more concussions were 3 times as likely to be depressed. And a similar study showed compounding recovery time and an increased likelihood in getting a concussion after you've already had one, not to mention the reduced cognitive function some of these players would experience after multiple head injuries. Another study on soccer players with multiple minor concussions showed that even after their neuropsychological test results had come back to the baseline, visual motor and motor cortex skills were impaired long after. Now, with me telling you all this information, I'm in no way trying to discourage you from playing the sports you want to play or doing the things you want to do. Rather, take safety precautions. If you hit your head, go to the doctor, get checked out, and make sure you follow your physician's advice to the letter. You have to ensure that you get a full recovery time, because the sooner you get back out there and hurt yourself again, the longer it's going to take and the easier it's going to be to get concussion after that. Full recovery is vital to making sure that you can keep your brain as healthy as you can for as long as you can.